Well, hi there. Warm welcome. You're watching Times Now, and I'm Meghna Deka here on Blueprint Explosive Exclusive. The focus is going to be the fight back against COVID. Well, amidst the rise in the COVID cases and also the concerns over the new Jn1 strain, today the Health Ministry held a high-level meeting to review the preparedness COVID-19. In fact, Union Health Minister Mansook Mandaviya has held the review meeting virtually with the state health ministers amid the COVID surge during Christmas as well as New Year festivities. All present for the meeting agreed that the crowd management is going to be the main focus and the test, track, treat, vaccinate mantra is essential to all our steps.
इस मीटिंग में आज की कोविड-19 की जो सिचुएशन है उसका रिव्यू किया गया है। सेक्रेटरी साहब की तरफ से एक डिटेल्ड प्रेजेंटेशन उनके समक्ष लाई गई और ओवरऑल पिक्चर ये है कि देश में लगभग 2300 एक्टिव केसेस हैं। जो सिचुएशन मान लीजिए 1.5 महीना पहले थे उसके मुकाबले में बढ़ोतरी हुई है। पॉजिटिविटी भी कई जगह पे बढ़ी है। हमारे अस्पतालों की तैयारी, पीएसए प्लांट्स की तैयारी, क्रिटिकल केयर की तैयारी, प्रोटोकॉल्स की तैयारी और टीम्स की तैयारी पूरी होनी चाहिए। हमें सर्वेलेंस में ताकत और लानी है, ये उन्होंने रिक्वेस्ट करी है।
So which are the states which really should be on the lookout? Here we have mapped for you state-wise the kind of active COVID cases which are being reported over the last 5 days. First, starting with Kerala. Unfortunately, this is the state which has seen the sharpest of hike. In Kerala, 15th of December, there were 1,144 active cases. This caseload has now shot up to 2,041. The next in line was Karnataka. From 50 on 15th of December, the number of active COVID cases has gone up to 79. Across in Tamil Nadu, from 36 active cases, it's now gone up to 77. Across in Maharashtra, you have from 19, the number of active cases going up to 35. In Goa, now you can see geographically also how the spread is very, very visible in all of this. You have from 15 the number going up to 23. All these states, neighboring states where you can see this curve. But now what does this mean overall for India? Now remember, the numbers may not be alarming right now, but is this the beginning of the next wave? Well, that is the biggest worry. Watch this. On 15th of December in India, there were 312. Then steadily it went up the next day to 339. By 17th of December, there were 35. Then you had 260, a slight dip, and then it went up to 288. And look at this today. Today, on the 28th of December, there are as many as 614 active cases of COVID which have been reported, which is why there is a reason behind the entire pressing of the alarm button which has happened. Listen in to some of the reactions which have been coming in.
ಅವರಿಗೆ ಒಂದು ಹೈಪರ್ಟೆನ್ಷನ್ ಇತ್ತು, ಆಮೇಲೆ ಲಂಗ್ ಡಿಸೀಸ್ ಇತ್ತು, ಬ್ರಾಂಕಿಯಲ್ ಆಸ್ತಮಾ ಇತ್ತು, ಮತ್ತೆ ಪಲ್ಮನರಿ TB ಇತ್ತು, ಆಮೇಲೆ ಹಾರ್ಟ್ ಫೇಲಿಯರ್ ಆಯಿತು. ಅವ್ರಿಗೆ ಹಾರ್ಟ್ ಫೇಲಿಯರ್, ಕಾರ್ಡಿಯಕ್ ಅರಿಥ್ಮಿಯಾ ಎಲ್ಲ ಇತ್ತು. ಸೊ ಕಾರ್ಡಿಯೋಜೆನಿಕ್ ಶಾಕ್ ಆಗಿತ್ತು. ಸೊ ಆಲ್ಸೋ ಈಗ COVID-19 ಕೂಡ ಪಾಸಿಟಿವ್ ನ್ಯೂಮೋನಿಯಾ ಇತ್ತು ಅವ್ರಿಗೆ. ಅದು ಕೂಡ ಒಟ್ಟಾರೆ ಏನಂತ ಹೇಳಿದ್ರೆ ಯಾರು ಭಯ ಭೀತಿಗೆ ಒಳಗಾಗಬಾರ್ದು ಅಂತ ಒಂದು ನಾವೇನು ಮಾಡಿದ್ದೀವಿ ಅಂತ ಎಲ್ಲ ಕಡ್ಡಾಯವಾಗಿ ನಮ್ಮ ಎಲ್ಲ ಹೆಲ್ತ್ ವರ್ಕರ್ಸ್ ಏನಿದ್ದಾರೆ, ನಮ್ಮ ಇಲಾಖೆ ಅಂದರೆ ಗೌರ್ಮೆಂಟ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ಸು ಪ್ಲಸ್ ಪ್ರೈವೇಟ್ ಎಲ್ಲರೂ ಕೂಡ ಕಡ್ಡಾಯವಾಗಿ ಮಾಸ್ಕ್ಗಳನ್ನು ಹಾಕೊಳ್ಳಿ ಅಂತ ನಾವು ಡೈರೆಕ್ಷನ್ ಕೊಡ್ತೀವಿ. ಯಾಕಂದರೆ ಅವ್ರ ಎಕ್ಸ್ಪೋಜರ್ ಜಾಸ್ತಿ ಇರ್ತದೆ. ಸೊ ಎಲ್ಲರೂ ಕೂಡ ಕಂಪಲ್ಸರಿ ಮಾಸ್ಕ್ ಹಾಕೊಳ್ಳಿ ಎಲ್ಲ ನಮ್ಮ ಹೆಲ್ತ್ ವರ್ಕರ್ಸ್ಗೆ, ಯಾಕಂದರೆ ಅವರು ಎಕ್ಸ್ಪೋಜರ್ ಜಾಸ್ತಿ ಇರ್ತದೆ. ಮತ್ತು ನಾಳೆ ಮುಖ್ಯಮಂತ್ರಿಗಳು ಕೂಡ ಸಭೆ ಕರೆದು ಡಿಸ್ಕಷನ್ ಮಾಡ್ತೀವಿ. ಈ ಟೆಸ್ಟಿಂಗ್ ಕೂಡ ಹೆಚ್ಚು ಮಾಡ್ಕೊಡ್ತೀವಿ. ದಿವಸ ಹೆಚ್ಚು ಮಾಡ್ತಾ ಒಂದು 5,000 ಕೊಟ್ಟಬೇಕು ಅಂತ ಇದ್ದೀವಿ ನಾವು.
So what really happened, the guidelines which have been issued and the curbs which are in place? Let's get you in the state of Karnataka, but also let's get you a quick ground report on whether or not the people are actually following this. Watch this report.
As there are talks of COVID cases coming back to India, is there a need for you to panic? Should you be worried? Well, the Union Health Government says not. But having said that, there is a need to be vigilant and alert. There was a meeting that was held today with all of the state health ministers, and in light of cases being reported, especially in Kerala, the state of Karnataka too has now in fact been put on an alert mode here. While there's no panic that's been created, the government has said that the state should be alerted, measures should be taken. Now, the Karnataka government, in fact, has mandated the wearing of masks for 60-plus people across the state, especially in crowded areas. Now, remember, we've always seen that senior citizens and those suffering from SARI or ILIs or respiratory issues have been the worst affected, even in the previous waves of COVID. Now, while there may not be an alarming number of cases in Karnataka, a total of about 79 cases have been reported, of which 62 are in home isolation, is what the government has said. It is, of course, urged at this point in time that people try and avoid crowded spaces or claustrophobic or, areas, in fact, that aren't well ventilated. Because remember, even with the festive season right around the corner right now and possibly a huge migration of people from the neighboring states as well, there could possibly be a reason for concern, maybe at a later stage. But for now, it's important to keep your stand up, to keep your vigil up and ensure that you are a responsible citizen and wear your mask if at all you are in a crowded area.
So this here is a call-in show. We are asking you, the viewers, to connect with us directly at the numbers flashing at the bottom of your screens. This is a time when we are very careful not to press the panic button, and we should instead stick to precautions. We have none other than Dr. Sandeep Nayar joining us. He is the Principal Director and the HOD of Chest and Respiratory Diseases at BLK Max Super Speciality Hospital. And if you have any questions specifically about COVID, about what are the symptoms, what are the precautions, you can simply pick up the phones and call us at the numbers there flashing at the bottom of your screens. Dr. Nayar is going to be answering those questions. But Dr. Nayar, I'm going to start it off because there is one question that everyone and one worry, literally everyone is worried about. We have the festive season around the corner. The flights have been booked, the tickets have been booked already, you have hotel reservations being made. Should we be pressing the panic button?
Nothing to panic as of now, and I hope that it doesn't go as high as it was going before. But I think we have to take precautions. That COVID-appropriate behavior and the cough etiquette should be banned. If you are going in a crowded place, then please wear masks. Or anyone who is elderly with a comorbid condition, please take precautions. Don't unnecessarily hang around. Try to remain inside because this has just started, this variant. Probably we will be able to curtail it, and it is not that harmful also. It's causing only mild disease. But again, those people who have comorbid condition, please take special precautions. And there's no harm in wearing a mask, the hand hygiene, social distancing, that COVID-appropriate behavior.
Absolutely.
If it has come back, please be there.
That's good advice. Let me go across. Several of our viewers have been calling in. They are lining up to ask you questions. We have Manoharan, who's our viewer calling us from Chennai. Go ahead, Manoharan.
Hello, good evening, sir. Sandeep Nayar, sir, doctor. I'm calling from Chennai, and I am a senior citizen, say about 62 years. And my worry is, of course, I mean, if I am asked to wear mask, it's not a problem. But I already have taken this COVID, injections, vaccines.
Vaccines.
Say about last but year. And do I have to go for a booster, or it is okay that if mask alone is enough?
Dr. Nayar, do they need a booster shot?
This is both of them is important. The COVID who has not been vaccinated, please get yourself vaccinated. If you have been boosted, you got the booster. If you are totally vaccinated, fortunately, even this strain is getting contained. In fact, either you won't get it, or God forbid, if you get it, you won't be having any serious form of infection. So these already who have been vaccinated. So don't worry, this our vaccine covers this particular strain also. But still, even taken vaccine doesn't mean that we won't be getting contacted. So there's no harm in putting a mask whenever you're going in when you're going outside.
So vaccines, but definitely mask up as well. Let me go across to Vishweshwaran, one of our viewers calling us from Chennai. Go ahead.
Good evening, doctor. Myself and my wife and my family, we are going on a vacation to Kerala, Ashtamudi, and we have already booked our ticket. And all of us have had COVID illness sometime in the past. And myself and my wife have already had booster doses. And 3 injections are already over. Can you suggest any more precautions? And we cannot cancel at this last moment. And we have done the booking. Please advise me.
Dr. Nayar?
The people are going on a holiday season, Christmas season, and then coming New Year. Of course, everything is booked. But please take precautions. It's good you have taken all the vaccines, including the booster dose. But despite that, please take all the precautions. I know it will be covering you from COVID, and in case even if you catch it, there will be no severe infection. But please take all the precautions. Happy holidaying to you. But please, social distancing, masking, and hand hygiene. Please continue that.
Don't cancel your travel plans, but take precautions, Dr. Nayar says. Let me bring in Suhasini, one of our viewers calling us from Bengaluru. Suhasini, go ahead.
Hi, thank you. I'm from Hyderabad. Doctor, good evening. Do we need to take any precautions for the age group of 70 plus or the children? And how dangerous is this, doctor? Thank you so much.
Dr. Nayar?
So precaution has to be taken by everyone. It's not that only the elderly and the children takes it. Everyone has to take it. It's only the extremes of ages, the elderly ones and the children ones, they are more prone to get any infection, the severe forms, because our immunity is less in the elderly as well as the children. So everyone has to take the precautions. And this mask, like I said, COVID appropriate behavior means that mask, the social distancing and the hand hygiene, along with vaccine, can really take care of this COVID.
So nothing to worry about. Raj, one of our viewers calling us from Bengaluru. Go ahead, Raj.
Yeah, hi. My question is, I want to ask, is there any vaccination approved for children from 5 to 12? Because government has already approved 3 vaccinations which have not been enrolled for the kids. How are we dealing with this now?
Very important question there, Dr. Nayar. What about the children?
So the children, basically, fortunately, this COVID had not really harmed the children as much it has harmed the adults. And when for any vaccine to come into the world, it has to go number of trials. And these also vaccines were, hurriedly came to the market because the COVID was causing havoc. So children, we have to be very careful when we introduce the vaccine, because you have to see their immunity and you have to see that there is no side effect in the long run. So as of now, any vaccine you have taken it is very good for you. Fortunately, sometimes mixing of vaccine, which we have seen, is working even better. So any vaccine we have taken it, please take it. If you have not taken in any booster, please, you can still take it. It will definitely cause the protection. And very few in future, I'm sure that even the children are going to get vaccinated. As of now, still the trials are on.
The trials are not on right now. We are still waiting for the final note to come along before we have vaccines for the children. We also have Ramesh, one of our viewers, calling us from Delhi. Go ahead, Ramesh.
Yes, just I want to confirm what are these preparations being carried out with the central government and the state government, and what are the awareness activities being carried out for creating precautions among the public.
Right. Dr. Nayar, some of them have already been enumerated by our reporters. One of them, of course, is masking in public places. Anything else you'd like to add?
I think many countries, other countries have also started. In fact, Singapore is already mandatory to wear a mask, and I'm sure that our government is also looking into it. Fortunately, like I said, this is not a very severe form of infection. It is, as of now, it is causing a milder form, and I hope that it doesn't cause any problem. But still, everything is at place, and thanks to the program like this, where we are spreading the news that please start wearing the mask and take all the precautions.
Mask Up India, that of course has been a Times Now campaign for the last 3 years. Let me go across to Shankaran, who's joining us. Our viewer calling us from Chennai. Go ahead, Shankaran.
I'm Shankaran speaking.
Yes, Shankaran, we can hear you. Go ahead.
I'm Shankaran. See, I am a senior assistant, about 8 years old. I'm basically a veterinarian microbiologist. And I had a slight throat. For that, I took goggling with aglamentine, and I took the tablets 655 twice a day and four times. And I also take goggling by betadine and everything. And I already taken about 6 tablets. And is there any? And I'm taking mask, and even by walking, I will do it in my house. Is there any other precautions? I have taken 2 vaccines, booster. This is necessary. 3rd vaccine is necessary.
Dr. Nayar?
So, this is a problem at this point of time that there are a number of other viruses also going in the this winter season. So it's not only the COVID which is prevalent. You will have respiratory syncytial virus, you will have flu viruses. So many of them are even mycoplasma for that matter. So a number of viruses are there at present, and we have to be very careful. So my request is that in case you have any flu-like symptoms or any problem like this, please consult your physician, and this is again time to get an RT-PCR done in case the symptoms are there, because the symptoms get masked, the same symptoms, also URI, so you're not really sure whether it's due to COVID or maybe it's another just a passing flu. So please get yourself tested, and most of these viruses don't need antibiotic like you said you took it. The antibiotics are only for the bacteria. Most of the time you need it only a conservative management. So please try over-treating with the antibiotic also at this time.
Well, unfortunately, we're running out of time, but Dr. Sandeep Nayar, thank you so much for answering so many of the queries that our viewers have been calling in, and of course all the viewers for calling in here on the show. It reminds us how important it is for us to mask up. Don't panic. Take precautions instead. That is the advice coming in from the good Dr. Nayar. Thank you so much, ever so much, for giving out the good advice. And we are hoping that together we can win the battle against COVID yet again. With that, a short break. Don't go anywhere.